look, we're recording this, and I promised to give this to you. And we're really talking about a very important topic, which is the vagus nerve. And why, who should even care about the vagus nerve, you know? But the truth is this, Jose, you and I look after people with inflammation all day long. That's what we measure, that's what we ask for, that's what we look at in our joints. And then we think, let's give a chemical. And you were the first one, Jose, to alert me to this breathing technique. I'll be honest, I know we've done the integrative fellowship, University of Arizona. I'd heard about it, but until you made those physicians go through that technique in Florida at the Society of Rheumatology. Honestly, Victoria Mazes is next to me. I'm there. We're both doing it. And honestly, I got clarity unlike anything. I think I'd spoken my short talk by then, and you came later. And I'm very excitable. And your talk somehow that technique I just followed through. Okay, I hadn't done it quite like the way you led it. So I just want to acknowledge that. And folks, if you're watching this video, I just want to say hooray for Jose Pando. He's an NIH, a National Institute of Health, just extraordinary scientist who brings the best of clinical and scientific care to the bedside. Jose, you do it all. You really do.
Thank you, Nisha.
So thank you for spending this time with me after clinic at dinner time. And you said, no, I'll honor your request. So I just want to say thank you.
Oh,
Thank you.
you're very welcome. Let me tell you how I got involved with this and how I became a rheumatologist in 2 lines, because everything ties up together.
Yes.
I came to this country approximately, I don't know, 40 years ago almost. And as I came, I got involved in research in neuropsychoimmunology. At that time, it was a nascent field. People didn't know much about the relationship between the brain and the immune system. And from then it evolved, right? But it was regarding my training and the different things I did, there was always in the back of my mind how the brain can affect the immune system,
Yes.
right? And as we begin to learn more and begin to incorporate additional knowledge, it became clear that it affects the hypothalamo, pituitary, adrenal axis, affects the immune system as well.
Right.
And therefore, what better way to decrease the stimulation of the HPA axis than using the natural feedback mechanism that we were given, which is the stimulation of the vagal nerve. Right? So when I started practice, with Catherine, we tried to teach patients different ways to stimulate the vagal nerve, since it directly goes back to the back of your brain and will cause a mechanism in which it just decreases the sympathetic stimulation and balance the autonomic nervous system,
Right.
by creating a balance between the sympathetic and the parasympathetic nerves, right?
Right. Right. You know, you bring to mind this whole idea, and we're all in a fight or flight right now. Honestly, no, we are.
Yeah.
And there's great upheaval in medicine in around the world. It's just there. It is. You can't put your head in a sandbox. You just say, okay, this is what it is. What do I do to help just not only myself, but my patients? And what you're saying here is that the body, first of all, has an innate intelligence. The brain and the heart talk to each other. It's essential mechanism. And this is ongoing. It's like an eavesdropping mechanism on the whole system. And we're all in an inflammatory state. I know this, and in fact, just before I came on, I drank some milk because I feel the inflammatory. For me, milk is helpful. And then I take minerals, calcium and magnesium to just relax. And so what you're saying here is that the body has the intelligence to balance the great nervous system, the sympathetic, parasympathetic, and it's under our control.
That's
We are
correct.
in control of the master switch. And you mentioned that I said the breathing, and you said you and Catherine do this. Walk us through this, what it is you recognize and how you hack this nerve.
So let's first talk about what it is. Some of the people that are listening to this don't know what the name of vagus nerve come from or what it means, right?
Yes,
The
yes,
vagus nerve is the wandering nerve,
yes.
and it's one because it wanders, one of the cranial nerves, the only one that leaves the brain or the head, and it goes through the neck and goes down into your chest and then to your abdomen, and it goes to half of the colon. So we'll incorporate the nerves in the larynx, in the lungs, in the heart, as you mentioned, and in the gastrointestinal tract. So
Mm-hmm.
it will have, because of the autonomic nervous system, it will have an effect in your breathing, in your heart rate, in the way that your bowels behave.
Mm-hmm.
And those are the ways in which you can affect the vagal nerve, right?
Right. This is the ways,
So
the portals to gain entry into it. Right, right,
yeah.
right. Okay.
So and the vagal nerve also goes through the throat and to the larynx, and it has a little nerves that go back to the middle of the ears,
Mm-hmm.
right?
Mm-hmm.
And therefore, people that try to affect the vagal nerve use acupuncture in the ears,
Right. They
right?
massage the ear.
Yeah.
Yes. Yes.
And you put needles there and you stimulate, and sometimes they leave the needles and you have to rub them. I don't know if you have seen that,
I have seen that
or
actually.
push them
Yes.
just to stimulate, to keep on the vagal nerve in check. But
Mm-hmm.
if you know that it goes to the throat, how about if you hum and just
Mm.
humming will be a way to stimulate the vagal nerve.
Oh, this is
So
awesome.
basically, what happens and what Catherine does, she's very busy in clinic, and she has an assistant. There's a wonderful gentleman, and whenever they're pulling their heads with patients, they both begin to hum together, just to
Yes.
keep it in check. And you're stressed, but that will just bring you down. So if you feel that you're a little bit charged, just hum your way through the day, and that will stimulate the
Wow.
vagal nerve,
Yes.
right?
Yes.
Going a little bit deeper, if you take a deep, deep breath, the stimulation of the expansion of the chest and the diaphragm will also stimulate the vagal nerve,
Mm-hmm.
right? So you have the humming, you have the deep breathing, and you have a movement, like even dancing, but the movement that most people think about is yoga, in which you're moving different muscles in the costal cage, in the abdomen, or whatnot, and that will stimulate the vagal nerve too.
Yes. Yes.
If
You
you
remind me of the time that an acupuncturist left a little um, pellet almost, and really it just popped it in there and told me to massage it. And this is what would happen, Jose. I would yawn. Just I would miss, and I would. Oh my God. And then it fell out naturally. She said, it'll fall out naturally. Don't worry about that within a few weeks, but you'll get the pattern of to relax yourself deeply. And I would yawn a lot. Yes. And it makes you relax totally. And you feel clarity too. You're hyper aware, but not overexcited like a caffeine drive. Rather, you're alert and calm. Yeah. Very nice. But I like the humming.
the humming is good. Do you know
Mm-hmm.
at the wellness center, Catherine invites regularly a lady to do um, music, and she does um, mindfulness through music, and
Mm-hmm.
that's a way to stimulate the vagal nerve as well. I
Yes.
don't exactly know the mechanism. It's easy when you just touch the nerve or breathe or whatnot, but this lady does a um, sound healing that stimulates the vagal nerve too. So there are different ways in
Yes.
which you can stimulate it
Mm-hmm.
in a
Mm-hmm.
natural way, in a way that is easy or relatively easy to do.
Yes.
Eventually, you want, we can do the breathing technique. But it's something
Yes.
I brought for you, knowing that you were going to ask me about the vagal nerve.
Oh, we're going to do the 478 because I think people are um we're so interested in wellness and longevity and how to live properly, and we're very, very enamored with vitamins and diet and all that. But I think this, I'll tell you this, Jose, in my own practice, I don't think people breathe very well. When I'm listening to them, I have to say, are you breathing at all? Because I can barely hear you. So they're breathing very shallow. And you really need to encourage them. So they've forgotten there's really rapid, shallow, and once they start to breathe, they slow down immediately. And at the bedside, surely, when I was physically doing practice, I did teach them the breathing that you're going to take us through. And I'll tell you this, I would tell them, take your pulse, 15 seconds, put your finger. I would show them how to take the radial pulse. And then I'd say, okay, now close your eyes and I'll talk you to the 4, 7, and 8 breathing. And Jose, it's like a biofeedback.
That's right.
They noticed that their pulse would go down and they looked different. I would say, look at the mirror now. And they had clarity and they calmed down. And it's a wonderful way to give them on the spot. Here, you're regulating yourself now. And here's the thing: once people did that all the time, less phone calls to the nurse, especially Thanksgiving and Christmas when everybody's rheumatoid flares. This was, in fact, the nurse commented on me. She said, Dr. Manek, you're one of the few in this group I don't get phone calls for. I said, it's because they know how to regulate themselves. They know how to calm down and breathe and pace themselves. And so it does have a meaningful effect in doctors' calls and even their prescriptions. They go over the top into parasympathetic outflow and immune and tone down the inflammation that we see. I mean, it's absolutely scientific. So anyway, go ahead. So it's biofeedback, really.
It is. And there's different ways to do it. I mean, the 4,
Mhm.
7, 8 breath is one of them. Other ways in which you can balance the autonomic nervous system is with altered nose breathing, in
Oh,
which you inhale by one nostril, cover your nostrils, open the
yes.
other one, and exhale.
Okay.
And if you're very charged, if you need to stimulate your parasympathetic nervous system, you mainly focus on the left nostril.
Yes.
So you take a deep breath with the left nostril, you wait a few seconds, exhale to the right, and then you inhale
Ah,
again to the left.
yes.
That will
Yes.
stimulate, I mean, if you want a balance, you do it with both, alternate. But if you want to mainly just cool down fast, you mainly breathe by the left.
Yes.
And that will stimulate your parasympathetic nervous system.
This is wonderful. That's a very important clue.
When
Wow.
for your patients, if they they practice and they tell you, I'm ready for the next level,
Mm-hmm.
then you show them the Kapalabhati breathing, the product you have,
Mm-hmm. Yes. The
which is just
bellows
the
breathing. Yeah.
basic rapid contraction of the abdominal wall. And of course, that contraction will stimulate the vagal nerve,
Mm-hmm.
but it also will stir the pot a little bit. So
Yes.
things that are bugging you will come up. So you have to warn people about that,
Yes. Kapalabhati is like a bellows breath. I think you
like a
force
bellows.
exhalation and then you literally get rid of crap, I
Yes,
think.
right.
That's a very good thing.
Yeah.
Uh-huh.
So
I
it
have
just
some.
helps you to release stuff.